Well, I find that when I talk to people about the Tuskegee experiment, I think there's a lot of misconception about what that actually was. Um, it was a study that went on from 1932 to 1972, and it really was about not treating. It was about withholding treatment, observing the natural course of disease in African American males. Um, comparing it to the vaccine administration and vaccine studies, it's sort of like comparing apples and oranges. Well, I would argue that not treating COVID disease could be compared to the Tuskegee experiment. So that's really the comparison. To observe COVID disease in African American and Latino people and not treat it would be a fair comparison to this Tuskegee experiment. But when the discussions of vaccine are brought into that equation, it really doesn't match up in the same way. I mean, we could compare apples to apples. We can compare vaccine studies to other vaccine studies, but comparing vaccine treatment for COVID disease to a non-treatment study done, in the 1930s to 1970s is not a fair comparison. The only thing that would make any population more susceptible to catching it, from my understanding, and I have a significant background in infectious diseases, is having poor social distancing or poor, adherence to the measures that we know that can help you prevent disease. So some of that may be true for our communities, sort of believing that the virus is a hoax or something like that, and not wearing masks and not social distancing. So that could make individual groups more susceptible. Genetically or sort of constitutionally, we're not more susceptible to the virus.